Hello friends, welcome to CNS Viewpoint, and today we are going to talk about a very important development which has happened on tobacco control in our neighboring country from India and Thailand, Myanmar. In Myanmar, government has, amidst the crisis which is going on in the country, uh, and of course the global public health emergency caused by corona pandemic, Myanmar government has launched has approved um, a very important public health regulation, and that is they have enforced plain packaging of all tobacco products. So far, only four countries in Asia Pacific, and Myanmar is the fifth country in the whole of Asia Pacific region which has enforced plain packaging of all tobacco products. It's also known as standardized packaging. So, standardized or plain packaging is only enforced in Australia. It was first enforced in Australia in the world in 2012. Singapore, New Zealand, Thailand, and now Myanmar. So five countries in Asia and Pacific: Australia, New Zealand, Singapore, Thailand, and Myanmar. Myanmar, these five countries have set a very strong precedence because in the plain packaging has shown in Australia, for example, that tobacco use incidence in adults came down from 16 to 11%, or if I remember correctly, yes, 16%. It was 16% in 2012. It came down to 11% in 2019, and in 15 to 24 years age group, it came down from it was 12% in 2012, and it came down to 6% in 2019. So plain packaging basically hits the industry where it hurts most, because in these countries already advertising, tobacco promotion, sponsorship is banned. So tobacco industry only has one place to advertise its products, and brand reinforcement and brand recognition and all those kind of marketing tactics. The tobacco pack is a very strong avenue for the tobacco industry, and that is why tobacco industry was so trying everything possible to stop Australia from enforcing plain packaging in 2012, if you remember correctly. And that is why the tobacco industry does not want plain packaging, because it really hurts the marketing of the deadly products. Because plain packaging means that there will whether it is brand A, B, C, D, E, F, G, H, I, whatever brand, they will all will look the same. All the brand names will be similar in similar font size, color scheme, etc., dull and stuff. No other thing like flashy and whatever, nothing. Strong pictorial warning, and only essential information, whatever is required as per the domestic laws. So basically it rips apart. Currently, if there is no plain packaging, then tobacco industry uses all its marketing tactics and puts all the might and tricks of marketing advertising, so that health messaging looks almost fades away, almost is very difficult to read in the all the glamour and the lifestyle imagery and the advertising tactics of the tobacco industry, where to catch the fancy and brand recognition and brand reinforcement of the product, for current users as well as for potential users, which is children and young people. As we all know that most of the tobacco addiction begins under the age of 18. So the tobacco pack plays a very important role, and that is why plain packaging is important, because plain packaging actually is yielding the fruits which efforts like pictorial health warnings, etc., were not able to fully maximize, because these were subdued. The pictorial health warnings were contesting with all the brand imagery on the pack, all the kind of tactics to which tobacco industry was doing to undermine those. So basically it will just enhance, and that is what has seen in all the countries wherever the pictorial health the plain packaging has been reinforced. It's a whole new level of enforcing regulations, and that is why it is so important. And as Dr. Tara Singh Bam, the Asia Pacific Director of International Union Against Tuberculosis and Lung Disease, he said that tobacco packaging is a mobile billboard promoting consumption of tobacco products. So true, because the tobacco users carry the packs with them, or so basically it's like a mobile billboard, and that is why plain packaging strips away the decoration, gloss, and misleading elements of tobacco packaging. That is what Dr. Tara Singh Bam had said. Uh, which is very, very true. So it reduces, plain packaging reduces the attractiveness of tobacco products, eliminate the effect of tobacco packaging as a form of advertising and promotion. It eliminates package design techniques that may suggest some products are less harmful than others, like light, mild, etc. All tobacco product kills. Full stop. So it's very important to kill the tactics of these lies, deception of this tobacco industry, to save lives, to save our children and young people in falling into the trap of the industry. And of course, plain packaging increases the noticeability and effectiveness of health warnings. There are several countries which have enforced plain packaging around the world. I think almost 1/10 of the whole world has enforced, in terms of number of countries. I think 21 or so countries or more have already enforced it. For example, as I already said, 5 countries in Asia Pacific has enforced this: Singapore, Australia, New Zealand, Thailand, and Myanmar. And apart from that, if you look around the world, you will find France, England, Norway, Ireland, Uruguay, Saudi Arabia, Slovenia, Turkey, Israel, Canada, Belgium, Netherlands, Hungary, and others have also enforced it, which is really, really such an important step forward. So, and this will definitely help Myanmar government in enforcing and yielding the best of benefits of intended benefits of the tobacco control legislation in their country, and also the public health goals. So let us like, for example, non-communicable diseases or other infectious diseases, like tobacco is also responsible for non-communicable diseases, but also infectious diseases like tuberculosis, like COVID-19. I believe that COVID-19, because all the serious outcomes of COVID-19, the diseases which are comorbidities, which are associated with serious outcomes of COVID-19, these comorbidities, one of the major risk factors of these comorbidities, COVID-19 comorbidities, is tobacco. So why should not tobacco industry be held liable? Because if tobacco industry had not interfered in the implementation of global tobacco treaty and domestic tobacco control legislations, then tobacco control would have been much more effective. Lesser people would be using tobacco, which means the burden of tobacco-caused diseases would be less when the pandemic had struck us, and less people would have been vulnerable in a hypothetical situation to coronavirus. So, and tuberculosis, of course, is very well established scientific fact that there is a direct link between tobacco and latent tuberculosis, tobacco and active TB disease, and in terms of disease prevention, disease control, disease management, as well as TB deaths. So coming back to Myanmar, Myanmar has done a very good job, but at the same time, health is not an isolated subject. Let us also hope that Myanmar has a federal democracy, real federal democracy at every level, because health is part of the whole big puzzle. Whole big cog in the is one of the cog in the wheels, and several other cog in the wheels which can ensure health security as well as social security for every citizen in Burma, in Myanmar. And but however, even in these difficult times, Myanmar Health Ministry has done a very important job. It's a whole leap forward. So our appreciation towards that, and also the hope for federal democracy in Myanmar. With these words, I will end today's CNS Viewpoint, and tomorrow again we will be back again at 5 p.m. with the views and thoughts and perspectives on something that made us think. So bye till then. Stay safe, stay healthy, and take care of yourself. It's almost end of October, so in some parts of the world, at least where we are, it starts to become cold, but also the air quality declines very, very significantly. So stay healthy, take care of yourself. Bye bye. Tomorrow, 5 p.m. India time, again, like every day. Bye bye. Bye till then.